genomics and genetics, those are related to cancer, those are related to, certain diseases, other diseases like, inherited diseases, as well as, newborn screening, those kind of tests, so rare diseases which doctor talks about. So those kind of tests are very rare, and those tests take a long time to give the report. So the labs take somewhere around 3 to 4 weeks to give those reports. So that was a big challenge in testing, especially in oncology, when we need to know what is the level of involvement of each organ, or what kind of levels the disease has progressed, and what kind of treatment we should give to the patient. So this can be decided only based on the kind of profile that we get out of the tests. So for this, the tests usually take about, as I told you, 3 to 4 weeks, or sometimes even 2 months. So here for myeloid malignancies, especially for hematological diseases, so we have brought out a test which will get the test released in 3 days. So that is a big opportunity, and this helps the doctor in deciding on the patient outcomes in a much better way. Those details will be explained by the doctors going forward. So regarding this genomics as such, if I want to talk about it, so the world market is about it's about $17 billion is the world market today. It's a very growing field. In India, if you see, the market is about $150 million. That's about 1,250 crores kind of a thing. If you see today, it's a very small component. If you take our overall laboratory market size is about 55,000 crores. In the country, but out of that, it's about 1,250 crores. It's roughly 2 to 3% of the overall market now. But it's one of the fastest growing segments in our industry. For example, we talked about PCR about 30-40 years back. So at that time, when PCR was invented, it was a very new test. So, but then when we saw when it came to COVID and all that, we saw that PCR was a very common test at that point of time. So from there, it has grown from a very small proportion to a very large portion. It has grown. So similarly, we are expecting that with genomics and such high-end tests also, there will be a higher growth opportunity, and there's an expectation of about 15% CAGR for this component of genetics and genomic testing compared to regular lab testing, which will grow at about 10 to 12%. So that is how this is going to be a very prominent feature. At Agilus Diagnostics, we have set up major laboratories across the country. So our global reference laboratory is in Mumbai, where we have a genomics lab which is NABL and CAP accredited. We also have a very high-end reference laboratory in Gurgaon, where we do, it's an NABL accredited laboratory, where we have a center of excellence in transplant immunology. And we have recently added the genomics department, which is headed by Dr. Srinidhi. So where we do all these hematological malignancies, and we are adding new tests as well. Currently, we have close to about 600 tests as part of this portfolio, and we hope to keep growing this.